Welcome to Equine Guelph's Research Radio, a monthly look at the cutting-edge research and work being done at Equine Guelph, brought to you by SSG Gloves. It's one of the more overlooked aspects of equine care, especially in performance horses. Eye care is extremely important to the equine athlete and horses in general. We'll talk about that with Dr. Chantel Pinard, Associate Professor of Ophthalmology at University of Guelph. But first, SSG Gloves is also on the cutting edge. The SSG All-Weather is the most popular of all-weather gloves in the industry worldwide. Quality, durability, well, it wears like an iron and washes like a rag. Breathable, AquaSuede Plus Palm gives you a very good grip on the lines, wet or dry. And the elasticized back gives a cool, comfortable fit. The SSG All-Weather. See your local SSG dealer. For more info, go to ssgridinggloves.com. Dr. Pinard, welcome to Research Radio.
Thank you very much for having me.
Now, eye care is something that tends to be overlooked, especially in performance horses. Tell us how important eye care really is.
Well, of course, I'm a little biased being an ophthalmologist, and I think that eye care is important in all horses. And so the bottom line is that it's not just performance horses. One example is the fact that horses are prey animals, and so they do rely on sight in order to get away from danger. And so having less vision can be certainly much more stressful to them, and therefore welfare can be sometimes impacted that way.
Well, I was thinking about this before we came on to do the interview, and I'm thinking in terms of the performance horse, the standardbred, the thoroughbred. If it's okay for the jocks and drivers to wear protective eye covering, it seems to make sense that the horse's eye care should be of paramount importance, given the fact that they're racing over a surface that they may not normally be running over in their natural habitat. They're getting dust thrown into their faces and into their eyes and so on.
Yes, but remember, most of those jockeys and so forth have more than one set of goggles on their faces, and they're able to remove them as they get dirty. Versus the horses wouldn't be able to do that.
True.
And so, if the goggles per se get covered in any type of debris, then that would potentially be more detrimental to the horse. So, just a normal acting of blinking will be. Is what they normally do, just to get rid of any debris that's coming their way. Okay, that's a typical layman's question, and I'm glad you clarified that for me. You said that horse vision's not as focused or multicolored. Could you expand on that? Absolutely. Horses are what we call dichromatic. People are trichromatic. One analogy has been shown that us people actually see three types of colors, versus horses only see two. They see blues and yellows. So in one respect, the analogy is that horses are kind of red-green colorblind. And so the reds and the greens will look more like a hue of gray. And so therefore, they don't necessarily see all the colors that we see. And contrast actually plays a bigger factor in order for them to be discerning, for example, jumps and so forth.
That's something I wanted to touch on, because if a horse has an impairment, it's going to affect his or her ability to perform at his optimum, isn't it?
Well, absolutely. I mean, there is a study proven out there that has shown that, for example, horses jumping indoors versus outdoors had a little bit more faults when they were jumping with blue blue fences versus green fences. And again, to be quite honest with you, the thing is that there's I think with the indoor arenas, what happens is that there's not enough light in order to form contrast, in order for the horse to be able to distinguish or to judge jumps as better, versus outdoors there's much more light, and so therefore they're able to accommodate a little bit better for the jumps.
What are some of the most common eye ailments, the most common ocular diseases?
Well, the most common that I would say by far is basically what we call corneal trauma. So the cornea, which is the clear part of the eye, the one that we actually blink over, it's kind of the window that we see through, is prone to trauma. So as you were saying, in terms of flying debris or just rolling around, of course they're putting their heads into hay bales and so forth. Those are all areas where, if not being careful, then they can definitely traumatize that and cause an ulcer or a paper cut, an abrasion. With time, that will heal very well on its own with minimal scarring, but if bacteria gets in there, or more importantly, if fungus gets in there, then you have what we call a complex ulcer that can actually be quite vision-threatening in some cases. Okay.
How are they treated?
Well, this is a challenge with some horses in terms of some horses when they have a painful eye are very reluctant to have their eye opened and be having ointments or drops put into the eye. On one respect, ointments are a little bit easier than drops because you don't have to tilt the head of such a big animal. And so ointments at least 4 times a day may be needed, and a combination of medications may be needed depending on what we have. And some horses where they're either head shy or they're so painful or things are just so dramatic that we need to be doing either every 2-hour administration, then we can actually put what we call a subpalpebral lavage system. And the subpalpebral lavage system is a little tube that is actually inserted into the eyelid, and then it can be threaded through the mane, so the person can be injecting into the tube without necessarily opening up the eye. And for some horses, this is the only way that we can actually medicate the eye. Of course, there are some medications that we can give by mouth, but the most common medication is going to be some type of eye drop or ointment.
Fascinating stuff about a topic that is, pardon the pun, overlooked. Dr. Pinard, thank you for this.
Well, you're very welcome.